Okay. Hi, everyone. Thanks for joining us today for our April is Stress Awareness Month. So we're having a stress awareness health series. Um, and we're in the last week of April. So I'm really happy to be here with Dr. Connie, who is our chiropractor and functional medicine practitioner at Princeton Integrative Health, to talk about stress and how it affects our health. So Dr. Connie, can you give us just a general idea of how stress impacts our overall health?
Sure. We have both good stress and bad stress. And oftentimes when we say the word stress, people think about that bad stress, portion of it, which in the interim can be a good thing. It can help to get things done and help us to accomplish goals and, leave us feeling alive and things like that. But sort of chronic long-term, exposure to stress can really be degrading to our bodies and start to cause a breakdown. So we don't want to be exposed long term to stress in a high level, because it does really start to do bad things to our bodies. Yeah.
What kinds of things can it do to our bodies over the long term, like you mentioned?
So it can accelerate aging, it can weaken our immune systems, it can make it hard for us to manage our emotions. Makes us turn towards not great habits like drinking and smoking and not eating good food. It can impair our memory, it affects our sleep, which is huge for healing in our immune system. It can interfere with energy levels and concentration. It can cause mood swings and anxiety. It can lead to depression and anger issues. It can lead to a lot of disease, because chronic stress creates inflammation, and every disease state starts with inflammation. So
Wow, so that really does affect all of our systems in our bodies.
every single bit of it. Yeah, it's important to learn how to manage stress. And like I said, it's good to have it in the short interim,
Right.
because it really does help us to get things done and help you grow and evolve. But when you're exposed to it long term, then it's not great.
Yeah. So if you are exposed to that long term, how can an integrative approach to managing stress and managing our health really help us, heal those systems and create, balance and health in our bodies?
So here at Princeton Integrative Health, we have a number of modalities that we utilize to help people combat that chronic stress and to help integrate daily stress. And a couple of those things, you guys spoke yesterday with Joe Bonacci, who's our acupuncturist, really can help to integrate stress on a daily basis and release stress in the way of muscle tension. But we also have chiropractic care in the office, which helps to stimulate the parasympathetic nervous system. The parasympathetic nervous system is our rest and digest and heal side of the nervous system, versus the sympathetic, which is the fight or flight. And that's what's being triggered when you're in a state of chronic stress. So research shows that a chiropractic adjustment actually stimulates the parasympathetic nervous system and puts you into that rest and digest and heal state. So using modalities like acupuncture and chiropractic are really, really great ways to help combat chronic stress and help us to integrate daily life.
Yeah.
Stress is, and in any form, causes a chemical reaction in the body, whether it's a stressful thought, a traumatic event, or a toxin that we are exposed to. Your body either integrates it or it has trouble integrating it, and it holds it in the body in some way or another. And if we aren't able to integrate and move it through, then it manifests and then we see symptoms. So using things like chiropractic adjustments and acupuncture are really, really great ways to help to release and to integrate daily stressors.
Yeah, absolutely. And Joe did mention yesterday something similar, as you said. You could go through a traumatic event like a car accident, and you get whiplash, and you have that muscle tension. It's not just this physical thing. You are still holding on to that mental feeling of that fear that you experienced, and going through that. So it all, you can try to heal yourself from the physical, but you need to also heal from that internal mental state of stress that you experienced.
Yeah. And I like to encourage people to tap into their bodies, because we've always And most people have had the experience, like at the end of a really long day, you either will complain like, oh, I just like have this band of tension around my head, or my neck just feels so tight. And so you're holding emotions in different parts of your body. And that's what I mean when I say it's all just, chemical reactions. Emotions are chemical reactions in our body. And it just depends on what chemicals are being produced and whether or not you're able to work through it.
Right. Absolutely.
Sometimes we need a little help.
Yes, definitely. And what other types of, if someone were to come in for, they're having stress, or if they, have some sort of illness that they aren't able to get a handle on, what would be the first steps if they were to come in and meet with you or one of the other practitioners?
So I often say that we sort of take a little bit of a triage approach, and
Mhm.
it depends on what's going on. That we will either recommend, chiropractic care first, acupuncture, or we go down the functional medicine route.
Right.
So it kind of depends. People that are in acute pain or having, sort of, we would choose whether or not acupuncture or chiropractic would be better to start. Oftentimes it 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 actually often doesn't really matter whether or not you start with acupuncture or chiropractic.
Mhm.
We find that people do really, really well when they're under both, and
Yeah.
that oftentimes ends up what's happening. They'll start with seeing Joe, and then Joe will say to me, like, I want you to work on these things with this patient. And so then they'll start seeing me, and then they'll come in and they'll see him first, and then they'll come in for an adjustment afterwards. And that same and vice versa. People will come in to see me for chiropractic issues or reasons, and then I'll refer them to Joe to start working on some things. So um, it's sort of a little bit triage. But if people have, they're dealing with weight gain, or gut issues or things like that, then of course we send them sort of down the functional medicine route first, because we want to get nutrition and that type of stress management under control. When we are talking more about toxins going into the body, we need to start removing that as a stressor. So it depends on what the stressors are, what the symptoms are, and how the patient's really handling or not handling them, where they would kind of go first.
Absolutely. So there is a lot of coupling our different modalities and programs much of the time when people come in, depending on what they're struggling with.
Yeah. And I mean, that's why we offer those multiple modalities, because we find that when people are kind of using all of them, they're getting so much better.
Absolutely. I mean, I remember I came in a couple months ago I had just awful neck pain, and I had a session with Joe and a session with you,
Mhm.
and combined it was like pretty quickly I had that relief. So
Yeah.
absolutely. I need to make an appointment with both of you again and start coming in more often.
It's
Um,
like, yeah.
Are there any tips that you can give to people as far as, obviously we want people to take an integrative approach and use these types of modalities, but just any other tips to reduce the stress of our everyday lives, in addition to that?
Yeah. We did this whole
Mhm.
series of the Dress for Success a couple of months ago. And one of the letters in Dress for Success is stress and how
Yeah,
to manage it. And so we talk about this every day in our practice on how to manage stress for patients. And um, breathing is huge. We encourage all of our patients to take some time during the day and focus in on your breath, pay attention to it, tap into it, see whether or not you are breathing, because oftentimes we just stop, especially when we're stressed out. So make sure that you are breathing and that you're focused in on it. And even just tapping in for a few breaths here and there throughout the day, it will bring you back into the present. It will make you realize that you do have some control in your life, even if it's over nothing but your breath. And brings you back down into that parasympathetic tone, which ultimately is what we want to try and be in most of the time.
yes.
Um,
Can't tell you how many times I've caught like almost sighed because I haven't really been breathing. And, my husband will be like, "Are you okay? What's going on?" Like, and I'm like, "No, I just haven't been breathing. So I'm gasping now." So
so
important, but we get, so overwhelmed, and we're multitasking and we're just doing a million things, and we forget to get back to the basics of truly just like being.
yes.
We are human beings, and we need to like do
Mhm.
that sometimes.
Yeah, absolutely. And be present, focus in on what's happening in the here and now. Don't worry about what you didn't do or what you were supposed to do later on today. it's not here yet, pay attention to what you're doing now and take it in stride. And that's going to help to really
Absolutely.
manage the amount of stress that you are experiencing in that moment. Stress is all about perception. So if we don't perceive stress, if our bodies don't perceive a stressful moment, then they're not going to react. It's not going to react that
Exactly.
way.
That is
So
so hard to do.
it
It
is
takes a
really hard.
lot of practice for sure.
Yeah, these are like simple tips, but just because they're simple doesn't mean it's easy.
Right.
It takes practice, like you said, and paying attention to your body throughout the day, intuitively listening to what you might need. I have this conversation a lot with patients because I'll say, how does something feel, or has anything changed? And they say, well, I don't really know. I haven't paid attention. And I want you to pay attention because your body is always giving you signals. It's always telling you exactly what it needs, but we do need to tap in. And that's part of coming back to, being present and paying attention to your breath, but noticing, even when you breathe, does your breath stop somewhere? Does it feel like it gets stuck? Are you noticing that maybe you needed to eat more, or you needed to drink more water, or you maybe didn't get enough sleep the night before? All of those things are going to affect the amount of stress that your body perceives throughout the day. So paying attention and looking intuitively at what your body needs, and then listening to it and actually acting on it, instead of being like, oh, I know I'm hungry, but I have to finish this thing, so I'm
Yeah.
not going to eat. I'll just skip my lunch and I'll eat later. No, take a moment and eat.
Yes. Everything else can wait. It is not a life or death situation. Work can wait. Even your kids can wait sometimes. You need to fill your own cup a lot of the time before you can continuously give to others.
Yeah,
And that includes, exercising and giving your body the right nutrients, and
right.
taking a moment to breathe or be alone, and just get back to your center.
Yeah. You mentioned exercise. That's another really, really great way to help to reduce stress. Moving on a daily basis, sweating,
Hmm.
um, helps to decrease stress and put us back into that parasympathetic
Hmm.
tone. You have to release in some way.
Yes.
And so making sure that exercise is part of your daily practice and moving throughout your day. If you have a job that you sit at all day, taking breaks, getting up, moving,
Going
even
outside.
going
Nice
outside, getting
out.
your feet on the ground and the sun on your face every day that you can,
Absolutely.
are all ways to help to reduce stress.
It's amazing how when the seasons shift at this time of year, how it can be a complete emotional and mental break, for just going through so many months of dark and dreary weather. So I hope
Yeah.
that the weather can help people's moods and stress levels.
Yes, I mean, I talk to patients almost every day about, I call it sun therapy, but getting out in the sun with as much skin as exposed as possible, starting with small and increasing, over the course of the season, so that you can spend up to an hour outside unprotected without sunscreen. And it helps to increase vitamin D levels, first and foremost, but it improves mood, because it helps to affect the neurotransmitters that are being produced in your body. And it's going to help to, set your circadian rhythm, which is going to improve healing and improve sleep. So get out in the sun. And if you can do it even one better, get your bare feet on the earth.
Yes, sand, grass, wherever.
Yeah, exactly.
Absolutely. I'm
Yeah.
very happy that it's finally getting warmer out.
I know
For sure.
yesterday was a gift, and now we're back to clouds
I
today.
know. But at least it's not cold. It was definitely beautiful yesterday, for sure.
Yeah.
All right. Well, I'm going to just check on Facebook really quick to see if we have any questions for Dr. Connie. Dr. Connie, thank you again for all of the information. I think we've had such great events this month about stress and how much stress impacts our health and our lives, and ways that we can, actually manage it in a healthy way. And
We have a lot of tools at Princeton Integrative Health to help manage stress. So take advantage of them for sure.
And you can call us at 609-512-1468 if you want to schedule a discovery session with any of our practitioners. You can go over your questions, concerns, any challenges that you're experiencing, and see what the recommendation is. It's free, so there's no, commitment. You can just get your questions answered. And then, yeah, we'll see what May has in store for us, but I'm sure we'll be doing lots more. And of course, I'm with Dr. Vinny on Thursdays at 4:30 for his brain health series, the Invincible Health series with Dr. Vin. But otherwise, I don't think we have any questions. So
Thanks.
thank you again.
Yeah, thank you. This is great.
All right. Thanks again, everyone. Have a good day.
Bye.
Bye.